Ahmedabad. I would like for a cordial thanks to the chairperson of Department of Eastern Medicine and Surgeon, Dr. Muhammad Akram, who has given me honor to give awareness about dengue fever. Dengue fever is a virus. Dengue virus is a viral agent carried by a specific species of Aedes mosquito, Aedes aegypti. Dengue fever is common in Latin America and in Asia. Therefore, according to World Health Organization, has established several models that could safeguard human life in accordance with the objectives, aspirations, and sustainable goals of the million. In addition, World Health Organization has developed a detailed report on the global policy and sustainable management needed to control and eradicate the spread of dengue virus. In the next 50 years, the incidence of dengue virus will gradually increase 30 times in the subtropical and tropical region of the world. The dengue virus is a single-stranded positive polarity ribonucleic acid virus which belongs to Flaviviridae family. It is a viral agent enveloped by a membrane. Dengue fever is also known as bone fever because during the course of the infection, the pain is more severe in the muscle and joints. It has been reported that 2.5 billion people are infected worldwide, with children being the most affected category of the population. The chronic form of the infection is called dengue hemorrhagic fever and is responsible for nearly 21,000 deaths each year. It has been discovered that classic dengue fever, which is also known as backbone fever resembles the symptoms of influenza. It primarily infects infants, young people, and adults, and infected patients can be symptomatic or may be asymptomatic. Asymptomatic carriers can transmit this virus. The Aedes aegypti mosquito is the primary vector of the infection, whereas Aedes albopictus is the secondary vector of dengue virus. The span of high fever is of about 3 to 14 days after the bite of this mosquito. The most common symptoms in this infected patients are anorexia, nausea, headache, arthralgia, and rashes. Also, sometimes seizures attack and dehydrations are the main complications which are we found in dengue virus fever patients. Treatment including control the temperature, relieve pain, avoid aspirin. Anti-inflammatory drugs are best for this, and number of plants are used for the treatment of dengue fevers and their plant extracts. Dengue hemorrhagic fever. The dengue hemorrhagic fever is spread to humans through the bites of Aedes aegypti and Aedes albopictus mosquito. This epidemic is more common in tropical African region, America, Western Pacific, and Southeast Asia. The eggs of Aegypti can survive in the presence of small amount of water and transform into larvae about the mature. This infection is more common in children with the age of 10 years. Moreover, it has been discovered that the symptoms of dengue hemorrhagic fever symptoms include fever, headache, as well as respiratory and intestinal involvements. Infants are more vulnerable to these infections, which can be responsible for their death. Early diagnosis and increase awareness responsible to help out this case. It has been reported to reduce complications if patients are managed properly. Dengue shock syndrome. The dengue shock syndrome is a severe form of dengue hemorrhagic fever. It often occurs between 2 and 6 days, usually with symptoms which include sudden collapse, sometimes cold, clammy extremities, weak and third-like pulse. Also, dengue shock syndrome is recognized as immediate occurrence of shock and hemorrhagic into the ears and skin, melena or hematemesis. Now, next is dengue epidemiology. The first record of dengue fever was documented in the Chinese Medipedia from the Jin dynasty and was referred to as a vital poisoning linked with flying insects. Benjamin Rush was the man who first coined the term breakbone fever. The very first case was confirmed in 1789 based on the symptoms of myalgia and arthralgia. Dengue fever by mosquitoes and its viral etiology were elucidated in the 20th century. The first outbreak of dengue hemorrhagic fever was observed in Manala in the year of 1953, and the rate of the epidemic dengue fever increased. In 1950s, many countries reporting an outbreak of dengue fever from 1980 to 1990s. Dengue fever became a priority to public health worldwide along with malaria. Dengue fever epidemic have been reported in Asia and Latin America, whereas different areas like Europe and Nepal, various kinds of intervention programs and remedies are available to combat this fever. Next, its symptoms. As we all know that there are four different types of serotypes of dengue virus 1, 2, 3, and 4. These serotypes are found in different regions of the world. It has been discovered that being infected with one serotype could lead to the development of long life immunity for the same serotypes, but only short term immunity to other serotypes. Common symptoms usually, as we already discussed about this, eye grade fever, headache, pain behind the eyes, arthritis. Also, infants and young children affected by dengue fever develop a rash on their body. Together with all the above other symptoms, platelets activity might also be affected, result in bleeding from different sides. Furthermore, जो dengue fever है वो severe हो जाता है जब हम उसको सही तरीके से ट्रीट नहीं कर रहे होते या हमें अर्ली जो है उसकी अगर हम डायग्नोज ना करें. Dengue fever becomes severe, then it may evolve into dengue hemorrhagic fever, which is associated with a high mortality rate. Before showing above symptoms, patient may be asymptomatic or may present with mild symptoms. Early hospitalization of patient with the above symptoms prevents further complications and inflammatory response, which could be fatal. Treatment. There is no specific drug available for the treatment of dengue. Moreover, there are different options that could be used for the effective management of this viral infection. This infection usually common in travelers. Therefore, there is a need for proper vaccination against it before traveling. The application of painkiller might relieve the pain, while adequate consumption of fluids and proper rest, as well as early diagnosis, could prevent the adverse outcome of this infection. So traveler must use insect repellent lotions and wear shirts with long sleeves, and trouser must try to sleep inside, especially if traveling to any other affected area where dengue fever is common. Also, there is need for the patient to be hospitalized if severe dehydration and bleeding develop. Patients suffering from this infection must avoid the use of aspirin. Aspirin क्यों? Because it causes bleeding. Also, infected person needs to check their red and white blood cells count regularly. Moreover, there are several vaccines that are available for the effective management of the four different serotypes of dengue fever. Dabirin has been effective in different experiments. We use this. It has shown less efficacy against mosquito virus. In the early stage of the infection, the use of antipyretic drugs might be effective. If the infection becomes severe, fluid such as albumin, we use 5%. Ringer lactate is best. Normal saline is good. Dextrose 5% should be given to prevent dehydration, because dehydration is one of the leading cause of this. Or it has been discovered that the platelets count can decrease and thus blood transfusion are recommended in patients with dengue hemorrhagic fever. Codeine and acetaminophen have also been recommended to dengue patients to relieve muscular pain. It has been shown that tetravalent chimeric vaccine is suitable options in the prevention of dengue fever. So it's all about this. It's over. Thank you so much. Thank you, Dr. Isba.